Good morning, everybody. This is a short video on the arterial supply of conducting system of the heart. Conducting system of the heart is composed of excitable tissue, which histologically represents specialized cardiac myocytes. Conducting system of the heart cannot be seen. We cannot see conducting system of the heart on dissection table. It can be seen only microscopically with the help of special stains. The system receives arterial supply from vessels which supply surrounding cardiac myocytes. But in contrast to cardiac myocytes, conducting system of the heart lacks capillaries. Arterial supply of the conducting system of heart is variable. As already discussed in the previous lectures, conducting system of the heart consists of SA node, AV node, bundle of His, right bundle of His, which divides into right and left bundle branches. Left bundle branch is further divided into left anterior fasciculus and the posterior fasciculus, which are also called the anterior and posterior divisions of the left bundle branch. Let us go to the blood supply of SA node. As already said, conducting system of the heart consists of specialized cardiac myocytes. They are supplied by the arteries which supply the surrounding cardiac myocytes. SA node is located in right atrium at the upper end of the crista terminalis, so it is supplied by the atrial branches of the coronary artery. This artery is called the SA nodal artery. It is a branch from right coronary artery in 60% of the individuals and branch from left coronary artery in 35% of individuals, according to a recent study. A recent study which was published in PubMed in 2003, in very small percentage of the cases, SA node has got dual blood supply, that is, it is supplied both by branches of right coronary artery and also by branches of left circumflex coronary artery in a very small percentage of cases. Atrioventricular node. As already discussed, this node is located in the cox triangle. It is supplied by AV nodal artery, which is a branch from right coronary artery in 90% of the cases, and in 10% of the cases, this vessel arises from left circumflex coronary artery. Blood supply of atrioventricular bundle of His. Atrioventricular bundle of His passes through the central fibrous body and along the posterior margin of the membranous interventricular septum to the junction of membranous and muscular parts of interventricular septum, as shown in this figure. This is the central fibrous body between anteriorly located aortic valve and posteriorly located tricuspid and mitral valves. It is also related to the posterior part of membranous septum. Its blood supply comes from septal branches of left coronary artery, that is left anterior descending coronary artery, which gives septal branches to supply the bundle of His. Arterial supply of the right bundle branch. Right bundle branch passes down on the right side of the interventricular septum. A part of it enters septomarginal trabeculae, which is also called the moderator band, which carries it to the base of the anterior papillary muscle, and the remainder breaks into fine fibers which supply the rest of cardiac musculature. It is supplied by the septal branch of left coronary artery. From left coronary artery, there is left anterior descending coronary artery, which gives septal branches which perforate and supply anterior two-thirds of the septum. Since right bundle branch is contained in the moderator band, it is supplied by septal branches from left anterior descending coronary artery. Right bundle branch, as shown in this diagram. Bundle of His breaks into two parts, right bundle branch and left bundle branch. Initial part of the right bundle branch passes through the septum and a part of it passes through moderator band. This part, which is contained in the moderator band, is supplied by left anterior descending coronary artery through its septal branches. Arterial supply of left bundle branch of His. Left bundle branch pierces the septum and passes down superficially on the left aspect of the septum. It then breaks into anterior and the posterior fasciculi. Arterial supply of anterior fasciculi or anterior division of the left bundle branch is largely by septal branches of left anterior descending coronary artery. Posterior fasciculus is supplied additionally by septal branch of right coronary artery. Thus, posterior division of the left bundle branch has got dual blood supply. It is supplied both by branches of left anterior descending coronary artery and also by branches of right coronary artery in case of right dominance. I want to summarize my lecture as SA node is supplied by right coronary artery in 65% of the cases, and left coronary artery in 35% of the cases. Acid node may have dual blood supply in a very small percentage of the cases where it is supplied both by right coronary as well as the left coronary artery. AV node receives its blood supply from right coronary artery in majority of the cases, and in 10% of the cases it is supplied by branches from the left coronary artery. Bundle of his is supplied by left anterior descending coronary artery through septal branches. Right bundle branch, which is contained in the moderator band, is supplied by left anterior descending coronary artery through its perforating septal branch. Anterior division of the left fasciculus is supplied by the left anterior descending coronary artery. Posterior fasciculus is supplied by left anterior descending and additionally by septal branch of the right coronary artery. Now let us go for a quiz based on this mini lecture. You will be provided an MCQ with four options. You have to choose the most accurate one. Which of the following coronary arteries supplies right bundle branch? Right, left marginal, left circumflex, left anterior descending. Right bundle branch is supplied by the left anterior descending coronary artery, so D is the correct option. Left bundle branch receives its arterial supply mainly from which coronary artery? Right, left, left anterior descending, all of the above. C is the correct option. Which of the following statements is false about the arterial supply of SA node? A. It is supplied by the right coronary artery. B. It is supplied by the left circumflex artery. C. It is supplied by left anterior descending artery. D. Has got dual arterial supply. C is the wrong option. False statement about arterial supply of AV node is it is supplied by the right coronary artery 90% of the. It is supplied by the left coronary artery in 10%. It is supplied by the left marginal artery. It is supplied by left circumflex coronary artery. C is the wrong option. Do not forget to like, subscribe and share this video. Thank you for watching.